Hey there, everybody. Welcome back to another episode of Pharmacy for the People. It's been a while since I've had the opportunity to actually record one of these things for you guys because in the last 5 weeks, my wife has given birth to our second beautiful little girl. She is a delight. She doesn't sleep. She cries all the time. We're exhausted, but we love her very much. Yeah, we're really tired. And probably in a different episode, I'll tell you a little bit more about why she's been such a difficult baby and what we've done to try to help with that, because it'll tie into some of our other topics. But for tonight, what do medications actually do? Sure, a doctor tells you to rub something on your skin, to take a tablet, to inject something, and it's supposed to fix you, right? But what is it actually doing once it's inside of your body? Does anybody actually know? Is it like Jack's Magic Beanstalks that just, throw them in the ground, do something, and everybody goes home happy? Are they some sort of golden troll coin to pay tiny troll health goblins? It's not that. If you're new here, my name is James. I'm a licensed practicing pharmacist, and if you enjoyed today's video, please let me know by liking, subscribing, and perhaps sending this to somebody who you think would actually find it helpful. Okay, so what are medications actually doing in our body? In the last few episodes, we've been talking about the underlying factors that affect how a medication does what it does, right? We talked about all these things about the application of medication. So we're talking about some of the base foundational information about how medications work. We talked about pharmacokinetics, how a medication is absorbed, distributed, metabolized, and eliminated from the body. And then we talked a little bit about pharmacodynamic properties of medications, and that is what a medication does when it gets there. And that's what we're talking about tonight. When a medication gets absorbed and distributed around your body, once it gets to where it needs to go, it is going to do a thing. It's going to have a function. And we call that function the mechanism of action for that medication. So when a med gets to where it needs to go, it performs its mechanism of action. This ice is kind of noisy. Think about it like our own jobs, right? Like you can't do your job unless you get to where you do your job, right? Like you have to commute first. Unless you're working from home because of the pandemic. It's an imperfect metaphor, whatever, stay with me. All right, so you have to get somewhere before you do your job. And that's the same thing like your medications. We wake up feeling refreshed, we enjoy our morning getting ready, and then we commute to work, get to the job, and then we do our job. And the same thing is true for medication. So they get absorbed into your body, they get distributed to where they need to go, and then when they're there, they perform their mechanism of action. And that's what we're going to talk about tonight, mechanisms of action. Different classes of medication have different mechanisms of action. A lot of times the way that we divide classes of meds is by their mechanisms of action. For instance, a really common class of medications are called beta blockers. They're commonly used to control our heart rates if your heart's going too fast, or your blood pressure if it's too high, or protect our hearts from beating too hard when they're literally trying to beat themselves to death. We'll get to that later. It's called heart failure. Beta blockers work by affecting the mechanisms that already exist around your heart. Your heart is already doing a thing. Beta blockers are just participating in that thing, right? On the outside of the cells that make up all of our various organs of our body are tiny little receptors. And these receptors act like switches, turning things on and off inside the cell regarding its function. On the outside of our cardiac cells that make up your heart, there are beta receptors that respond to beta adrenergic response. They respond to signaling molecules like adrenaline, adrenergic. That's what I'm talking about. Beta adrenergic receptors. Beta blockers do exactly what it sounds like they do. They block these beta adrenergic receptors from working the heart too hard. So it can help reduce the blood pressure and prevent strokes, heart attacks, and heart failure. All wonderful things to prevent. So these tiny receptors on the outsides of our cells are all over the place, and they trigger a bunch of different physiological functions, so many that we don't know them all yet. We're still learning about them. But because they're so prolific and because they control so much happening inside the cells, which make up the organs and then the functions of our body, these receptors are really common targets for medication development. If we can create something that affects these receptors, then it can help with a lot of different various issues in the body. For instance, insulin taken for diabetes communicates through those receptors on our cells to take blood glucose, to take sugar out of your blood, glucose, to create new glycogen in your liver, and to deposit fat into our adipose cells, your fat cells. Like losartan. Losartan is a angiotensin 2 receptor blocker. Losartan and other medications in that class block this particular receptor and help to reduce blood pressure in people whose blood pressure is too high. Morphine and other opioid analgesics bind to receptors and block a pain signal from being sent to your brain the way it normally would. These are all medications that affect these little receptors on the outsides of cells. But it doesn't have to be on the outside of cells. Some medications are able to go through the cell onto the inside and affect receptors that are either on little organelles or affect the organelles that make up the little functions inside of a cell, or even directly in the nucleus. Organelles. Do you remember organelles from high school biology? Those little things that you put in your cake when you make a cake for biology class. Do you guys have to do that? Does anybody else have to do that? You had to bake a cake of a cell and decorate it with all the organelles, the Golgi bodies. Anybody? No? Like steroids and thyroid medications go directly into the nucleus and communicate with the functions that are building proteins that help the cell function. They communicate which things they should turn off and turn on, kind of like in a factory. You've got like a factory foreman that's telling your cell which products to focus on and which ones to put on the back burner for right now. Some chemotherapy medications, like topoisomerase inhibitors, they prevent DNA from unwinding when it's time for a cell to double its DNA and then split and become two different cells when a cell is dividing and growing. In a cancer situation where you have cells growing and replicating in an uncontrolled way, a topoisomerase inhibitor prevents DNA from unwinding, which causes the cell to self-destruct, hopefully, in a cancer situation. But again, it's affecting these mechanisms that are inside the cell, not on the outside. Instead of affecting receptors inside or outside, some medications and their mechanisms of action will just block these little ion channels that prevent electrolytes like calcium and potassium and sodium from traveling in and out of cells. Electrolytes flow across cell membranes to create currents in cells, like in nerves and in muscle. They also flow through our kidneys, and our kidneys help to regulate how many electrolytes are actually in our bloodstream, and they eliminate it when in your urine. For instance, a calcium channel blocker blocks the amount of calcium that's able to influx into smooth muscle cells. Not skeletal muscle, like in your arms and fingers and such, but smooth muscle, like you might find in your blood vessels. By reducing the amount of calcium that's able to flow through these ion channels, a calcium channel blocker reduces how much this smooth muscle can contract, which in its effect reduces your blood pressure because it reduces how tightly these blood vessels contract. Another example would be like most medications that keep our heart in a normal rhythm, bump, 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 normal rhythm, lub-dub. There's a lot of other dangerous rhythms it can go into, but most of the medications that prevent your heart from going into these bad rhythms control how much sodium, potassium, and calcium flow through our heart, the heart cells, how rapidly they are able to depolarize and cause a contraction of the heart. Numbing agents like lidocaine or novocaine, like when you go to the dentist and they numb up your gums when they're doing horrible, horrible things. The benzocaine that's in this little lozenge in my mouth because my throat is sore. Or bupivacaine, nesicaine. These are sodium channel blockers, one of these ion channels that it prevents sodium from moving through the nerve well enough to fire off the pain signal like a Wild West gun celebration. And it prevents pain. It's a local numbing anesthetic. Or like water pills, diuretics that help to eliminate more fluid from your body or help to eliminate different electrolytes when things aren't right. If somebody has kidney disease and you're retaining water, these diuretics can help eliminate water, and it does it by affecting these ion channels on the cells in your kidneys. Some medications don't affect our cells at all. Like in an infection, antibiotics, antifungals, things that treat infections, most of them have a mechanism of action that affects the thing that's invading your body itself. So instead of going into your liver, it's going all over your body. But if you have an infection in your hand, it's also going and affecting the bacteria that's in your hand. It's going into the bacteria and having its mechanism of action there. Like most medications in the penicillin class, or all of them in the penicillin class. Penicillin itself, piperacillin, amoxicillin, ampicillin, these all work by stopping the outer cell wall of bacteria from being formed. So instead of forming a new bacteria, splitting apart like it normally does, penicillins act like a tiny little finger for their little bacteria bubbles, and they just pop instead. Most antiviral medications go into the cells where the viruses are replicating, using those mechanisms inside the cell to make more copies of itself, and it shuts down these mechanisms, either by affecting what the virus brought with it into the cell or affecting the cell itself. But it's a different kind of mechanism of action. All of these mechanisms of action are based on our understanding of these biochemical mechanisms that make our bodies function. And it's thanks to the devotion and investigation of generations of people, generations of scientists and other people, that we even have an inkling, a beginning to understand these things. The only way that we know what beta blockers do is by people going before us and investigating how the heart does what the heart does. And the only way that we know how antibiotics works is by studying the mechanisms that cause bacteria to divide and invade and create the diseases that we're trying to treat. Over the centuries, we've learned about biochemical pathways that illustrate the start and the finish of different functions in our body. And as we begin to understand these pathways, these mechanisms, we're able to devise ways to affect it. Like the way pain is created in our body when a cell membrane begins to break apart. Remember, the cell membrane is made up of this lipid bilayer. When it breaks apart, it does something. This is called the arachidonic acid pathway. And it goes from this broken cell membrane down to these signaling molecules that signal pain and create inflammation. After we learned this, we were able to create compounds that were able to affect this mechanism. Compounds that were eventually marketed as ibuprofen, indomethacin, celecoxib, etc. These are things in the NSAID class, NS, non-steroidal anti-inflammatory drugs. Same thing is true for other medications. We learn about some kind of process, some physiological process in the body, and find ways to alter it. Like anticoagulants or blood thinners, they work by affecting the clotting cascades, this process of how our bodies form clots. They help prevent strokes and other clotting diseases like deep vein thromboses. Medications that treat heart failure are all aimed at the physiology of how our bodies maintain the right amount of fluid and have the strength to move it around through the pump, our heart, the pump. Vitamin D, calcium, phosphorus, these are all maintained through a complex mechanism that you see here. Through the bones, kidney, liver, parathyroid glands, medications designed to affect diseases that affect this process are aimed at this process. And you don't have to understand these images. What I'm getting at is that our gradual understanding of these physiological processes led to our discovery of new medications that can help alter these processes when they start to hurt us. And then we have some medications that we don't really understand how they work. Their mechanisms of action aren't entirely clear. Hopefully, as our understanding of physiological processes increases, so will our understanding of these mechanisms of action. Can you hear the thunder? Might get a storm here. Then there are medications that were created kind of by happenstance when someone happened to observe a beneficial effect when someone took a medication. It wasn't what we were going for, but then you see this effect. You're like, hey, that's fantastic. Let's figure out what is causing this fantastic effect to happen. And that way we end up learning more about these physiological processes in ways that we didn't understand. All of these tiny receptors inside and outside our cells, all of these biochemical pathways and physiological processes, sometimes things don't go as planned. Sometimes 1 person out of 100 has a slight variation in their receptors that causes the medication to do something different. Sometimes it works differently than we expected it to. But that's a different topic. We'll have to get into why medications have side effects on a different day. But for today, the goal is to understand that when a medication gets to where it needs to go in your body, it is an active substance that changes the natural function of your body, what's naturally happening. Remember, natural doesn't always mean best. It can be very natural to die. It can be natural to have migraines. It could be natural to poop your pants in the middle of class. Natural doesn't always mean best. These effects can be on cellular receptors, it can be on little organelles inside of your cells, it can be through biochemical mechanisms, physiological pathways, signaling molecules, things we understand, things we don't understand. I plan to go through some specific mechanisms of action, what's really going on with these meds when we talk about some specific medications. But the goal for now, the answer to the question, what do medications actually do, is they perform their mechanisms of action. Hey, thank you so much for your time and your attention today. If you enjoyed this video, please let me know by liking and subscribing to the channel. If you have questions about specific mechanisms of action already, let me know. If I didn't make something really clear in the video that you want to know more about it, let me know down in the comments below. I love getting those questions and comments. Thanks again for your time and your attention. Hopefully now you're a little bit more equipped to handle medication questions for yourselves and for your family. Power to the people.